clock is the most recent completed month of age. So if he's 1 month or 1 month and a week or whatever, we just listed that as one, but that's not part of the calculations. That was just for reference. Then the next column is his weight in kilograms. The next column is his height in centimeters. The next column is his BMI, which is generally not calculated for children under 2. That's why those numbers start lower in the chart. And then percentiles for each of those for both weight and height. And then there is also a metric that the CDC publishes called weight for height, which is a way of assessing a child's weight relative to their height, so that you know kind of what was discussed previously with Dr. Molina, a child who's 5th percentile for height and 5th percentile for weight. Those are both low, but they may be at 50th percentile. They may be completely average when you compare their height and weight. So that's what the height for weight percentile is. And then the BMI percentile is the next column. The next column is the 50th percentile weight for their age. Next is the 50th percentile height for their age. And the previous one was 50th percentile of their weight for height. Meaning, so if a child is 3, the 50th percentile for a 3-year-old might be this number, but if he's a short kid, that number for his specific height will be lower, and that's what that weight for height column is.
So when we go through those 3, when you say the 50%, let me just get something. When we're talking about these 3 columns right here, did you have to come up with those columns in order to run the calculations?
Yes.
Okay, and so you've included that data to show your homework?
Essentially, yes.
Okay, so these aren't necessarily something that you need to understand the chart, but you're explaining how you get there, correct?
Correct.
All right, so, and then the final columns that you have.
So there's 3 columns at the end. One is where this child sits in the Gomez classification, which compares the child's weight to the average weight for a child his age. So it's based on weight for age. The next column is what's called the Waterlow classification. The next 2 columns actually look at that for both height and weight. The next to last column is the height column, which compares their actual height to the average height for their age. And then the weight classification at the end, which is the most helpful in looking at a child's nutritional status relative to starvation, compares this child's actual weight to the average weight for a child of his height. So it's a percentage. I mean, so if a child, say, is 1 meter tall, and the average, weighs, let's say 14 kilograms or 15 kilograms, and the average weight for a child that is as tall as they are would be 18 kilograms, then you divide 15 by 18 and you come up with a percentage, and that's what that is reflected in that last column. The second page of this is a categorization of what the way these categorizations then take those percentages and where they rank them. In the Gomez classification, anything over 90% is considered normal or not malnourished. Mild malnourishment would be in the 75 to 89% range. 60 to 74 would be moderate malnourishment, and below 60 would be severe malnourishment under the Gomez classification. And that only looks at comparing the weight and the child's age, does not take height into account.
Let me stop you there. So when we're talking about serious bodily injury, at what point would that become like what color would that?
I mean, it would depend on the specifics of the case, but certainly I would not expect it in the normal range, would not expect it in the mild range.
And then in regards to the Waterlow?
So the Waterlow classification, as I said, compares, looks at both height and weight to give you some understanding of the chronicity of it. When you look at the height classifications for children that die of starvation under 1 year, they haven't really lived long enough to be stunted in their growth, and so you generally don't see stunting in young children, but as they get older, you can see stunting. And then the wasting portion of it, again, it compares that child's actual body weight to the average body weight for a child, their height, the 50th percentile weight for their height. And if they're over 90, that's considered normal. If they're over 80, between 80 and 90, it's considered mild wasting. If they're between 70 and 80, it's moderate. And if it's under 70, they're severe. I list at the bottom a specific reference, but there are 18 cases of fatal starvation listed in that were all classified according to this categorization. And with one exception, in a teenager, that it says in the report was they had a normal Waterlow weight classification, but their death was predominantly due to dehydration, which is not an issue in this case. All of the others fell predominantly in the severe range. Many of them were as 70 or below is considered severe, and there were kids in this classification who were in the 40s even. The prior case here from San Antonio, when those numbers are put into this calculation, that was 51%.
Let me stop you there. You're talking about the prior case that Cervera County Medical was interested in 2003.
Yes.
And that with a weight of 7.17 kilograms, correct?
I believe that was what it was. Yes.
Is what that child had when he was weighing the medical examiners. And the weight that Benji had at the time of medical examiners, which you agree was 12.7.
Yes.
So, and they were only 6 months apart, correct?
I believe that's right. Yes. They were both 4.
They were both 4. And so that other child, by that classification, based off those weights, would have fallen into severe,
Yes,
correct?
quite far into severe. Yes.
Now, you talk about moderate, but there's 3 that are moderate. Did you have any details as to where they fell in the moderate?
They were right around 70%. I think one was like 70.4 and one was 70.6 or so. They were very close to 70.
Okay, and 70 being the wasting that would be severe.
Yes.
Okay, so they were at the very low side
Yes.
into the almost severe side of the moderate. Okay, I'm going to come back to the chart, and then when we're looking at, and so there's been testimony that Brandon did not, that Benji did not come to live with Brandon until January 2019. Are you aware of that?
Yes.
Okay, and so the line that is drawn right here, would you agree is the point at which, the earliest point at which Brandon would have had Benji?
At this point,
I'm just trying to identify the line.
If you could, I'll allow you for any questions.
So, I mean, this line is there to indicate what?
So if you look at the dates on the left side that we discussed previously, there's a large gap in the middle where we don't have any weights. The last one is in 2018, we don't have one until 2020, and that's what that line is, and that is also the period during which Benji supposedly came to live with Brandon.
And so, in looking at the water flow per weight, because right now that's been the big focus, you said that that's in regards to this case, that seems to be the most relevant.
Yes.
Or-
So,
Okay. And during Brandon's care, is he predominantly, what conclusions can you draw in regards to the water weight?
his Waterlow classification would put him as not malnourished, and except for the very last weight that's recorded at the time of autopsy, he is otherwise above into the what would be considered not malnourished, which also goes along with what's in the records that people are not commenting on his nutrition, that he was described to be before his death as well as malnourished. All of those things go along with that categorization as well.
So, am I understanding that you not just did the numbers, but then you went and looked at the medical records to see if what the doctors were viewing was substantiated by the data?
Yes.
All right.
height data basically gives you information about stunting, and as you can see, nearly his whole life he's been in the yellow range, which would be considered mild stunting. And whether that's because he started as a preemie, whether that's just because he's a preemie, I mean, I don't know why, but clearly the documentation is that throughout his life he has been in the mild stunting range. That he's very short is what that essentially means.
And then over in Gomez, again, do you have any concerns with that? The Gomez classification classified him as having any kind of severe malnourishment.
Severe, no. I mean, it certainly does list his, he dips into the low or the mild malnutrition range by the Gomez classification. But again, the reason that Waterlow is preferable to Gomez is that it references his height as well, which Gomez does not. It's just a comparison of his weight to the average weight for his age and taking his stature into account.
Now, I want to call attention to the bottom box. And what do these numbers represent?
So these are examples. Ms. Sawyer's asked me to look at the numbers. If I took the numbers that were done at autopsy, the 28 pounds and the 39 inches, and added decimals to those, if we didn't know, what would those categorizations be if it was, say, 12.9 kilos instead of 12.7, or if it would be 13.1, whatever those numbers is, some adjustments basically, and to see, that fall within the range of 28 if you don't consider the specific fraction. And those still, the numbers don't really change at autopsy.
On the classifications,
On the
correct?
classification.
However, would you agree with me that by adding a 0.4 to the pounds or a 0.9, that it does tend to give quite different results as far as where we see the kilograms, the conversion from the pound to kilograms?
Judge, I'm going to check this point for reading. Would you agree with me?
All right,
Okay.
please. Does it, the conversion from pounds to kilograms, what is there, does it make a difference when you convert it?
Yes, it matters how you do it, and it matters how many decimal points you include. For example, just looking at the actual data from the autopsy, if you use 28 pounds and convert that to kilograms, that's 12.7 kilograms, or if you use 2 decimal points, it's 12.72 kilograms. And that even that 2/100ths of a kilogram difference makes the difference between a BMI of 13, which is what I calculated, and a BMI of 12, which she calculated. So even those small differences will make a difference in what shows up. It doesn't really change the classification, but certainly makes a difference in how things look.
Now, you heard testimony from Dr. Medina, that she took the BMI and tried to convert it to the 15 or 16, BMI of 15 or 16. Is that realistic for Benji?
And I mean, his, I think the discussion that I heard around that basically described him, if he had stayed on that highest point of the curve where he ever was, would his weight loss be more substantial? The answer to that is obviously yes, but looking at where most of his life was on that growth curve, his weight loss is, quite different and much less impressive overall.
And so, after reviewing all the data, what is your conclusion as to whether or not Benji suffered serious bodily injury due to starvation?
I do not believe that he did.
Now, if you do not, and do you believe that he died because of starvation?
I do not.
And if he did not die because of starvation, do you have other differential diagnoses that you would, after reviewing the data, that you need to consider?
Yes.
Okay, and what are those?
So if we assume that starvation is not based on this data. If I get to that point in my review, I don't think this is starvation, so what else can it be? I have a child with no abnormal organs, he's thin, but really nothing else to drive me in one direction in terms of the cause of death. So that's what we would typically describe as a negative autopsy. In that setting, there are a number of things that are known to cause death with no visible external findings. Those would include asphyxial deaths of any kind, whether accidental or intentional. It would include seizure-related deaths. It would include arrhythmic deaths, meaning not arrhythmia as a mechanism of death. If many people, all of us, when we eventually die, it's because our heart stops. Okay, we have a fatal arrhythmia at the end, regardless of what started that ball rolling. But there are certain conditions where people have arrhythmias as a primary disorder, where they have genetic predisposition to sudden death because of abnormalities in molecules in their heart. And some of those also are associated with seizures. Those same gene abnormalities are associated with seizures. And both of those can cause death without leaving anything to see at autopsy. Other things that can do it, certainly untreated diabetes could be part of that as well. That would probably be the main things. Generally, that's not going to be a part of the differential of a negative autopsy, but in this case, it is something that I think I would consider based on the labs. We can talk about that more.
Okay, so just because this is a big word, I'm gonna write it out so that we asphyxia. It's not a word that we generally use, right? In like people's terms.
Mhm.
And what is asphyxia? What does it include?
Asphyxia is a broad category of death that means someone is not getting enough oxygen. That can result from choking. It can result from suffocation. Broadly covers anything that blocks the external airway. Can be choking is an internal blockage of the airway, which can also be associated with that. It is associated with certain chemical toxins, cyanide, for example, carbon monoxide. Both limit your body's ability to use oxygen. You can breathe fine, but the oxygen is not getting in there. And then any kind of what's referred to as a vitiated atmosphere, if it's most commonly described, for example, in silos and other places where the normal amount of oxygen is not in the atmosphere, and so if someone goes into that place and there's not enough oxygen to breathe, they will die because of that.
Now, let me ask you, suffocation, the word suffocation has been mentioned. Is suffocation necessarily choking?
No, suffocation is not the same as choking. It's a much broader thing. It would include smothering, for example, with a pillow, with a hand, anything like that. It would include, you can certainly have asphyxia from strangulation and other things, but suffocation really refers to blockage in the airway as opposed to pressure on the neck or something else.
Okay, and so in regards to autopsies, can we pick up, let's focus on the attention on suffocation. Can we pick up if someone has been suffocated at the time of autopsy?
So in fatal cases of suffocation, if it's an accidental thing, then there may not be anything to see. If somebody ends up with their face in a place where they can't breathe accidentally, then there's still not likely to be anything that you can see. In the setting of homicidal suffocation or smothering, certainly there are things that you can see. You may see bruising on the lips. You may see tears of what are called the frenulum, the little fold of your gums right there in the middle. Sometimes that'll be torn because the person is struggling against whoever's trying to smother them. But all of those things may not be present. It doesn't exclude the possibility.
So if someone took their hand and threw it over a child's mouth, it wouldn't necessarily, you're saying it doesn't always exclude that possibility?
It does not. And children in particular, because the differential in size between an adult and a child, if it's an adult trying to smother an adult, you're more likely to see injuries simply because their ability to resist is much more. A child is small and doesn't have the same strength or the ability to fight off an adult assailant. And so they may, and you certainly can, if you block someone's airway, they will lose consciousness very quickly, sometimes in a matter of seconds. And so there's not a lot of opportunity necessarily for them to have injuries that you will see.
Now, I'm showing you what's been marked as Defense Exhibit 33 and turning your attention to the investigative report that's already in evidence. And I don't know if you're going to be able to see that on the screen, but you can see it or
More or less.
more or less.
That's better for sure.
Can you read that to this paragraph?
Sure. On 8/17/2021, around 6:20 hours, the NOK next of kin left for work, and the stepmother got all the children up in order to take the 10-year-old to school. The stepmother reported that the decedent cried the entire time. The decedent was seatbelted into his car seat the whole way to the school. On the way back, at approximately 8:22 hours, the stepmother recorded a video to send to the next of kin of the decedent standing in between the two car seats, crying and yelling for bread. They stopped at a drive-through taco shop and went home. The decedent ate an egg taco with no obvious issue. Stepmother laid the 6-month-old in the bassinet in her room and then laid down on her bed with the decedent on one side of her and the 2-year-old on the other. The stepmother reported she waited until all 3 children were asleep, then fell asleep herself around 900 hours. Around 1000 hours, the stepmother woke up and noted the decedent foaming at the mouth next to her on the bed, exact position not described to the San Antonio Police Department. The stepmother called the next of kin, then gathered all 3 children into her vehicle and started to drive the decedent toward a hospital.
And can you read just the first sentence of the next paragraph?
At 11:04 hours, 911 was called by the stepmother while driving.
So, in the investigative report, there's an hour between she reports finding the child and calling 911, correct?
That's correct.
And so, at this stage, based off of your experience, is that an unusual amount of time to wait for medical?
I'm going to recommend this is outside the scope of his expertise as a medical examiner and
As a medical examiner, are y'all required to review investigative reports
Yes, it's a routine part of the job.
to determine why, what to investigate in your autopsy?
It is done to evaluate the circumstances surrounding the death.
And so, in your review of these reports, have you often had an opportunity to see fact patterns that involve calls to 911?
Yes.
Okay. And if the child is found unresponsive, does that tend to trigger the need for immediate medical assistance?
In most of the cases I review, it prompts an immediate call to 911.
And that was not done here, correct?
By that report, no.
So we've talked about asphyxia. Let's talk about seizures. Now, can an autopsy pick up whether or not someone has passed away due to a seizure?
No. So a seizure is abnormal electrical activity in your brain. And once you have passed, there's no longer any electrical activity. So we don't see seizures. There are sometimes things that we can identify at autopsy, lacerations of the tongue, evidence that the person is wet or pooped on themselves, that can go along with seizures. One thing that's described in Benji's case, would be consistent with that, he's described as having foam coming out of his mouth. That's an indication of pulmonary edema. That is also a non-specific thing. It can be seen in asphyxia. It certainly can be seen in seizures. We see it in drowning. We see it in drug overdose. There's lots of other things, but it is a significant finding as well.
And so Have you ever, in your experience, had the first seizure be a terminal event, meaning cause someone's death?
So yeah, that's a little bit of a complicated question. The short answer is yes. So most of the time, if someone does not have a diagnosis of epilepsy already or a known seizure disorder, it is difficult to say that that their death. If you're not witnessing a seizure and you don't see any changes that go along with the seizure, to say that that's why they died. And even in cases where you have, for example, witnesses that say, "Well, I saw him seizing. I came in the room and he was seizing, and then he stopped moving and was dead." Just about anything that stops your blood flow, stops your heart beating. Eventually, if your brain's not getting oxygen, it's going to seize. If you're still conscious or still alive enough for that to happen. So a seizure in and of itself does not mean that's why the person died, but it's certainly a possibility. But I have seen cases certainly where we do see changes related to seizures, tongue bites, and voiding in the bed and things like that, where the person had no history of seizures. And so it is something you can see. It's certainly not a common thing, but it is something I've seen.
And then arrhythmias, you mean?
Sure. So primary arrhythmia disorders, and this does overlap somewhat into seizures as well, but there's a constellation, a collection of genes that we all have that create various parts of us and allow them to function in normal ways. Within our heart, the reason that our heart can beat, the electrical activity of our heart, is driven by the ability of certain molecules, particularly sodium, potassium, and calcium, to move across membranes in our heart. And if you inherit an abnormal gene for the channels, they call them ion channels, if those ion channels are abnormal, you do certain of those mutations are well-described associations with sudden death. They, many times, there are certainly genes that can cause sudden death in the heart that are not related to rhythm disturbances. They maybe make the heart large and make the heart otherwise look abnormal. But most of what we call the channelopathies are these ion channel disorders that are inherited. The heart looks totally normal. It does not have any abnormality that you can see. And so just to look at it at autopsy can help you sort that out. There is genetic testing that can be done to look for those. Again, like most tests, they change the likelihood of various possible causes just because you find what's called a pathogenic gene. Say we find a mutation in this one specific gene that's described as a cause of sudden death. Doesn't mean that's why this person died of sudden death, but it certainly makes it more likely in that case.
And so was genetic testing, arrhythmia testing done in this case?
It was not.
And approximately how much does that run?
You can run, in our office, we would run an entire panel to look for a large constellation of arrhythmia genes, what are called cardiomyopathy genes, which are structural cardiac proteins that are abnormal, as well as seizure-related genes, and it was about $500 that we would spend to do that.
Now, moving on to diabetes, can you rule out diabetes in this case?
I think it's less likely as a cause of death, but it's certainly possible, and that's, I think, in large part because of the. There are clearly behaviors and described symptoms that go along with diabetes in this child. He's described as like drinking all the time, peeing all the time, wanting to eat all the time. All those things go along with, certainly new onset of type 1 diabetes. I think as was discussed, most children that will die of type 1 diabetes die of a condition called diabetic ketoacidosis, where they start to accumulate ketones in their blood. It's usually associated with a very, very high blood sugar, sometimes well over 1,000. And the combination of the high blood sugar and ketones in the blood is consistent with the diagnosis of diabetic ketoacidosis. In this case, the blood sugar, or the vitreous sugar, which is the only way we have to measure sugars at autopsy, looking at the vitreous fluid, his vitreous glucose was 45. That's not a particularly impressive number in and of itself, but certainly in a sample that it was well over 2 months after autopsy at the time that sample was tested. And vitreous glucose will drop over time. And so the fact that it's still 45 at the time of his, that it's tested 2 months after the autopsy suggests it was quite substantially higher prior to that. There's no way to know for sure, but it's certainly a possibility. And it's the fact that it's not 0 is kind of amazing, actually. And then the ketone testing, we did not see any, there was no ketones described in any of the testing that Dr. Molina described. She did say that they tested only for acetone. Acetone usually is an adequate test to look for ketones in the setting of DKA. But there are cases where you might want to or need to test for the other primary ketone bodies, which are acetoacetate and beta-hydroxybutyrate, or BHB. That would add additional, help you to be able to sort that out, especially in a case where there's been some delay in the testing. So I don't think that can be fully excluded as a possible cause of this child's death.
Because we also heard Dr. Molina say yesterday that they did not do beta-hydroxybutyrate testing, correct?
Yes.
And that they did not do
Acetoacetate.
testing.
Yes, that's correct.
All right, so in reviewing everything that you had, it can showing you, coming back to our original, what we started out with. Defendant's Exhibit 52. And I asked you, did you find that there was a failure to provide adequate hydration in this case?
No.
Did you find that there was a failure to provide proper medical care?
No.
Did you find that there was a failure to provide adequate nutrition in this case?
No.
Thank you. I pass the witness.
Just gotta get some water.
I'll let you get that first. Let me know when you're ready.
Okay, we're gonna go ahead and take a short 5 minute break.
All right, Mr. Jury.
Okay, everybody may be seated.
You guys. You're a huge hop up in right?
It is, for sure.
I probably have 6 to 8.
I'm right there with you, so mine usually like 2, but same idea.
One thing you should do.
said hi yesterday, but yes.
Okay. Don't want to be rude. But you knew I wanted to talk to you before you testified, correct?
I'm sorry?
You knew that I wanted to talk to you before you testified.
Yes.
You know how we were not able to speak?
My understanding is that you and I and Ms. Sawyers were supposed to talk all together, and we just couldn't, my understanding is schedules couldn't be worked out.
Okay, so you're not aware that Ms. Sawyer prevented me from talking?
Objection, Your Honor. I asked about you struck and
Judge, it goes to five.
improper comment and
Sustained as to sidebar, the jury will disregard the testimony. Please go ahead.
So, Farrah said we've never talked before today, as it relates to your ultimate finding.
That's correct.
Okay. Did you ever talk to Dr. Molina, or confer with her as it relates to your findings?
No.
So, I want to talk generally about the accreditation process. You were here during Dr. Molina's testimony,
Yes.
and you reviewed her testimony?
Not since hearing it, no. I mean, I heard her first day of testimony online before arriving in San Antonio, and then I was here one day for the rest of her testimony.
Okay. So what is name accreditation?
Name accreditation is a process, a voluntary process, but a process by which medical examiners' offices are seek accreditation from the National Association of Medical Examiners to essentially document to their communities that they are performing their work at what NAME considers an acceptable level.
Okay, and you were here during where Ms. Sawyers asked Dr. Molina as it relates to the Bibb County Medical Examiner's Office being on a provisional status. Correct?
Yes.
As it relates to the Utah Medical Examiner's Office, Bayer said it lost its accreditation in 1995, correct?
A long time ago, yes, but long before I was in the office.
Okay, so from 1995 to just about recently here to 2024, it did not have name accreditation.
That's correct.
And essentially during your whole tenure as chief medical examiner, it never had name accreditation, correct?
That's also correct.
You're getting paid to be here today, correct?
I am. I'm appointed by the court, yes.
And how much is your fee per hour?
I bill at $600 an hour.
And how many hours have you already put into this case?
I don't know for sure, but somewhere around 30.
Okay. Pull up, honey.
It's about $18,000.
$18,000 so far. Does that include your travel here?
It doesn't include the airfare and things, you know.
That $18,000 doesn't include the testimony you've already provided today? Those hours?
No.
And how much do you charge for testimony?
Essentially the same rate.
About $600 an hour.
Mm-hmm.
Sorry, about another $1,200, almost $1,800 so far for today.
Sounds right.
I want to talk about your history as it relates to completing autopsies on individuals who starved. My understanding is that you've completed one autopsy, and that was as it relates to an adult who died from what you stated was starvation, correct?
That's correct.
But that was essentially a complication due to schizophrenia.
Yes.
So in that case, the cause of death would be complications due to schizophrenia, correct?
No, his cause of death was starvation.
Okay, so you don't even consider the schizophrenia?
No, it was listed as a contributory factor.
Okay. As it relates to other cases that you have reviewed, my understanding is that you only reviewed other child starvation cases in your consultation practice. Is that?
Yes.
And when did you start your consultation practice?
Probably 10 years ago.
Okay, so while you were a medical examiner, you were also being able to do consultations?
Yes. All nights and weekends, much to my wife's chagrin.
Okay, and so you're getting paid by Utah, and then you're also doing your own side gig essentially.
Yes.
In that, how many cases do you think you reviewed as it relates to children who are starved?
I can think of one for sure because it was recent. I believe there was another, but I don't know for sure without referencing my records.
Okay. At your time as the medical examiner in Greenville, your time as a assistant medical examiner in Utah and chief medical examiner in Utah. Did any of those offices during your time there ever have a kid, a child that died from starvation?
Yes.
Okay. And you just weren't the medical examiner on it?
I was not assigned to those cases, yes.
So did you review them?
No, mostly not. I reviewed all pediatric death cases once I took over as chief medical examiner starting in 2016, but prior to that, no.
So from 2016 until 2024, were there any child deaths that resulted?
I believe there was one, but I don't recall for sure.
So you don't remember reviewing that case?
I don't remember specifics now.
You testified that you relied on literature as part of your forming your opinions today, correct?
That's correct.
I want to get the and that stated that the literature provides guidance of the degree of starvation present and what to look for in making that diagnosis. Fair to say?
Yes.
So, you are my first witness?
Yes.
I'm going to show you what I'm marked as state exhibit number 224 for identification purposes. Is that the Medea article that you were referring throughout your testimony?
It was one. He's written many, but yes.
Okay. Specifically, when you were talking about there was 18 children, and of those 18 children, and the basically the derivation of that data, that's what this study is, right?
Yes.
Okay. And that states exhibit number 224?
Yes.
Did you also review states exhibit number 225 as part of your testimony today?
Not as part of my testimony. I did review that article, yes, in my preparation for this case.
So you reviewed this article and used it in the ultimate analysis to reach your conclusion today?
Yes.
Okay. So I'm going to leave these copies here for you in case you need to refer to them.
Okay.
Okay? So, I want to talk first about the Medea article,
Okay.
which is stated in 224. My understanding of your testimony is that nearly all are in the severe range, none were within the mild range. Is that what your testimony is?
Yes. Well, I think they said, I don't remember if it was normal or mild range. There was one fatality in a child that was determined to have died of dehydration and not starvation.
Well,
Or not entirely starvation, let's put it that way.
If looking at table 15, you would agree with me, it says data of 18 infants who died of starvation
Yes.
with the estimation of a state of nutrition according to the Waterlow classification.
Yes.
So, again, I see the next note which says in case 18, cause of death mainly due to dehydration. That's not saying that in case 18 he didn't die, or that child did not die.
Correct. Correct.
And you said nearly all are in the severe range. And
Yes.
looking at that last column, weight in percent of ideal weight per height, specifically, you would agree with me that 4 of those 18 were actually within the moderate or mild range.
One was in the normal range because it's over 90.
Okay.
And 3 others are in the moderate range.
Okay. So that's 4 out of the 18. So that's about 22%. Would you say that's nearly all?
That 22% is nearly all.
Yes.
By itself, no.
Okay. So fair to say that not nearly all that were in the severe range.
No, nearly all of them were because 14 of the 18 were in the severe range.
Okay. So 22%, we can just ignore that 22%.
No.
Okay. Because 22%, let's say roughly 25, that's a quarter of those cases.
Mm-hmm.
That's not nearly all, you would agree?
No, it's almost a quarter.
What if it was 50%? Would that be nearly all?
No.
Your Honor, already noted. Overruled, you can continue.
No.
That would not be nearly all?
50%. If 50, I guess clarify for me, are you saying if 50% is in the moderate range,
Correct.
that would be half.
Okay. I'm trying to figure out what your cutoff for nearly all.
Believe my statement before about nearly all was nearly all were in the moderate or severe range, which in this table is 17 of 18 cases.
I went back and I listened, like you listened to Dr. Maline's testimony. He said nearly all in the severe range, none within the mild range. That would be an accurate statement.
No, that is an accurate statement. Nearly all 14 of 18 were in the severe range. One was in the normal range, not the mild range, and 3 were in the moderate range.
Okay. So I guess we should have a disagreement with nearly all. Of those 18 cases, do you know the circumstances of their death?
Not beyond what is listed in the article.
Do you know whether there was any medical treatment prior to their death?
I do not.
Do you know if there was resuscitation, meaning fluids were put into any of these children's bodies prior to them weighing?
I do not.
Okay. Fair to say it's pretty limited what you can gather from here, correct?
Yes.
And so, is it fair to say that you're basing a large portion or a significant amount of your opinion based on the fact that Benji doesn't fit in with this Waterlow classification system as expressed in this Medea article?
Yes, the Medea article outlines the data in all of these cases is from autopsies of children that died. It's autopsy data and is directly relevant to another autopsy.
Would you agree with me that this is the Waterlow with the Gomez, they're all anthropometric methods of classifying starvation?
Yes.
So I want you to move to page 290 of that article, if you can.
Yes.
In that right column, it says that comparison of these anthropometric indices revealed that the methods vary widely in categorizing children, with some identified as moderately or severely failing to thrive using one method and normal or mild using another method.
Yes.
And it goes on to say that according to these authors, there is no simple anthropometric measure that highlights.
Your Honor, I'm going to object to reading from a document that's not in evidence and
It's mentioned in his, he's relying as a learned treatise. It cannot be admitted as evidence, but it can be read into evidence as it relates to the rules.
You can ask him questions regarding this information to decide what you would like. I'll allow.
Thank you, Judge. And then it goes on to say, according to these authors, there is no simple anthropometric measure that highlights the degree of risk for a child, correct?
Correct. That's talking about risk of failure to thrive specifically.
Okay. And in that same article, would you go to page 288 in there? I can approach to show you kind of varying the text. We're starting right here.
Yes. Okay.
It says, cutoff values for fatal starvation have not yet been described in the literature. So this is not saying that, this article is not saying that moderate, severe, those are the cutoffs in order to have somebody die from starvation. Fair to say?
Correct. Yes.
Okay. So using this classification system does not indicate whether somebody was necessarily died from starvation.
Can you repeat that question?
In using the Waterlow, the Gomez, whatever classification system, just falling into the severe or mild doesn't in and of itself indicate whether somebody has died from starvation.
In and of itself, no. He specifically says, because most of the fatal cases fall below this amount, it may be reasonable, but there is, as he says, no cutoff for what determines fatal starvation has been described. But that's also partly why he lists his list of cases and shows where they all fit in the classification.
And have you reviewed other articles as it relates to going through compilation of data as it relates to starvation?
Yes.
Okay. And do you know what those names of those articles are?
Well, you handed me one of them, the Solarino article. I've seen 2 textbook chapters authored by Dr. Medea as well, and I have a whole long list of references on my computer that I've looked at over the course of this review that I don't.
And I'm talking about the data compilation from specific cases, meaning I looked at 6, I looked at 10.
Oh, gotcha. Yeah. No, I'm not aware of any other large compilations of data.
Okay. So in this, you'd agree it's limited in the sense that there's only 18 kids that are included within this study.
Yes, which is a lot when you consider this is something one pathologist might never see in the course of a whole career.
Again, but it's still, we're looking at 18 kids, and then you're making that, you're applying the standard in this case to Benji's case.
I'm applying, the information provided in his classification system and how he approaches that to the way I approach Benji's case. Yes.
As a review of your testimony to date, did Ms. Sawyers or anybody provide you the article that Dr. Lucifer wrote?
Yes.
Did you review that?
I did.
And in that, it contained a group of children as well, right?
Yes.
Did you consider that in reaching your ultimate opinion today?
I went back to look and see if I could classify them according to this. There was not sufficient data to do so. And I think there are some problems with that article, but I did not, no.
Okay, so that data that was in there was not useful for you?
I read it. There are things that are probably helpful in there. I couldn't pinpoint what they are, but it's not. It didn't help me make a determination as to this specific case.
So I wanted to go through with you and Ms. Sawyers had shown you some photos of Benji right on his death. I'll show you what's already been admitted is case exhibit number 76, specifically picture number 30, which the report indicates was captured on August 14th of 2021. Did you see this photograph?
I did, yes.
Okay. In looking at this photograph, compared to one of the earlier photographs that we have, it's clear that Benji's lost weight. Correct?
It appears that he has lost weight, yes. And
Yeah.
the numbers tell us that when you look at his measurements.
Right, and the numbers tell us also that he's not growing.
Correct.
So, in looking at, part of you talked about was the buccal fat, right?
Mm-hmm.
And so that buccal fat's around the cheeks, correct?
Yes.
And you would agree with me that there is a change in the amount of buccal fat between the two photographs.
Apparently, how much you can conclude from looking at the photos directly, without the same angle and everything else, I don't know. But he does appear skinnier, yes, I will agree with you,
Okay.
in the face.
What about his legs?
Not dramatically so, not really that I would say, yeah, these look different.
What about his arms? His arms are both.
Yeah,
They're at an angle.
I mean, you can't see his upper arms at all in the first picture, but I don't see an appreciable difference between the two.
Okay, you can see in here where the skin's kind of touching, and it's more skin's touching on this photograph, right?
I wouldn't say that.
Okay, so you can't see that there's a fullness difference in those two pictures of his arms?
In his arms, I would not say. I mean, there might be, and based on dates and weights, maybe he's different. But in terms of the appearance, I wouldn't certainly make any conclusions just based on that.
So you don't want to make any conclusions as to what's in the photographs?
No. Not for his arms and legs.
But you do want to make conclusions as it relates to defense exhibit number 22.
As I described, I do believe from the exhibits you showed as well as this one, his face is thinner than it was whenever that other picture was taken. I don't know the date of that, but his face appears thinner. It just doesn't appear cachectic or emaciated.
So we spent a lot of time just basically talking about the looks of somebody. Can you just look at an individual or a child and say they died of starvation?
There is literature that suggests it is primarily a visual diagnosis, and that most of the issues around the forensics of it are tied to making sure how that happened, as opposed to that it happened. Meaning, a child who is fatally starved looks fatally starved.
Okay, let's talk about an obese individual. Let's say you have an obese individual, you lock them in a room, you don't give them any food or water.
Mm-hmm.
Would you expect them to look cachectic at the time of their autopsy?
If they had no water, they'd die long before they got cachectic.
Okay, let's say we gave them distilled water, make sure there's nothing else in it. We gave them distilled water. Are they going to look cachectic at the time of their autopsy?
If they die from starvation, yes.
So they're going to go through...
It'll just take them a lot longer to get there.
So you would expect them to live for the entire time that their body had fat and or muscle?
It was substantially longer. I mean, that's in the literature that heavier people will live longer in a starvation state than thinner people.
So I'm talking about elimination of food, that there's not necessary nutrients in their body. Are they going to look cachectic at the time of their autopsy?
If they starve to death, yes.
Okay. So even an obese person who wasn't beginning, you need things like sodium to live, right?
Yes.
Potassium,
Yes.
other nutrients. So despite not receiving any of those nutrients as part of their diet, they would still live the entire time until they went through all of their...
I mean, it's going to obviously, potentially vary a little bit that way, but, they certainly might. I mean, it would take, there's pretty good data from hunger strikers and others who have said, I'm not going to eat at all. Generally, the idea that it will take somebody of a normal weight to start with anywhere from 45 to 60 days and a weight loss of 35 to 50% of their original weight before they will die. And obviously heavier people can last longer because they have more energy reserves, but they, whether they would die because of a sodium imbalance or something else because they're only drinking water, that's not described in the literature, where people only have had water. So.
Okay. So, I want to talk about the growth first for a little bit. Talk about safety exhibit number 111. So, fair to say between 0 and 21 or 22 months, there are data points related to where Benji is on the growth curve.
Yes.
Right. And then
Or not on the growth curve, that's the case, is most of it.
I'm sorry?
Or not on the, I mean, he's not even on it for a large portion of that.
Okay. We have data points for it.
Yes, we do. We have
Okay.
data.
And then between this period of time and 40 months, we have no data.
That's correct.
So-
None that I would be able, none that I reviewed, none that's in the medical records.
So are you making any assumptions about where Benji's weight is during this period of time?
But during that gap, no, I don't know.
And then when we have data points between 40 and 48 months, he's on, per CDC, the roughly 25 percentile, correct?
Yes, just below, yes.
Okay. That's why I said roughly.
Mm-hmm.
Okay. And then after this high point at 48 months, then we see the decline, correct?
Yes. Mhm.
So, fair to say, based on this data, you cannot tell that Benji is on or near the 50 or the 5th percentile for the majority of his life.
No, I mean, you have to exclude that large period where we have no idea where he is.
Right.
The majority of the known period of his weights, yes.
So, less than half of his life we know that he's roughly on the 5th curve.
Mhm.
But the other points, well, there's 2 points where he's close, nearly, or
Sure.
around the 25th percentile, and there's a gap where we don't know.
Right.
So it's not fair to say that, and I'm not saying you testified to this, but it's not fair to say that for half of his life, or the majority of his life, he was on the 5th percentile.
No, I mean, for the parts we know, he was in the low end of the growth curves, peaking at around 21. But yeah, I mean, for the parts we know, he's on the low side. But excuse me, we don't know about the gap.
So in looking at the second article, I want to go over some things with you.
Okay.
What's titled the Child Starvation on the Drugs. Do you have that in front of you?
Yes, it's a textbook chapter.
Okay. And I want to go to you, you go to page 967.
Okay.
WCS is the Waterlow classification system, correct?
Yes.
And in that says the WCS was shown to be suitable for grading severity of starvation, even though a threshold of values for legal starvation has not yet been described. Correct?
Yes, he's just quoting the article that we talked about previously, that there's no described cutoff value for what constitutes lethal starvation.
The Medina one.
Yes.
And again, that's saying that essentially Waterlow doesn't tell you at what point somebody's going to be dying from starvation.
That's correct.
And then it goes on to say the WCS, the Waterlow classification system, together with standard growth curves, is helpful in distinguishing between acute and chronic malnutrition and identifying duration, correct?
Yes.
And so that growth curve will be similar to what has been already put into evidence as states exhibit number 105, correct?
Yes.
On that same page, as it goes towards the bottom, number on page 967, it says that misdiagnosis of abuse and neglect because of carelessness towards children and or records by health and social workers have been reported in literature, correct?
Let me read that again.
Do you see it at the bottom?
Yes.
Okay, that's what that article says, or this chapter says.
It's quoting another article, but yes.
Okay. So as it relates to your opinion about whether Benji received proper medical care, you're basing that on your review of the medical records.
That's correct.
And fair to say that sometimes doctors don't always annotate everything that they see.
Oh, that is for sure the case, yes.
And sometimes they miss things.
Yes, they do.
Have you ever been in the clinical setting?
Yes, I worked 4 years as a primary care provider.
And what years were those?
1990 to 1994.
And I mean, zero disrespect to this question. Were electronic medical records a thing at that time?
No, thankfully.
Okay. But you are aware now that there's electronic medical
Yes.
records, and many times those contain like quick checklists that are done by different types of professionals.
Yes.
And many of those are demonstrated within the medical records that you reviewed, correct?
Yes.
So something that checks off a box doesn't mean necessarily they would get a full inquiry as it relates to that particular line.
That, I would say that's correct, yes.
Looking at that next page on 968, you agree with me that this particular article or chapter in which you used to help inform your opinion cites the Kellogg and the Whipper article,
It does.
and it also cites it on page 970. At the very top.
Yep. Yes, it's cited in those two places.
So at least this author found that article to be helpful in writing this particular chapter.
In making the points that he's making there. Yeah, one relative to you need to check the siblings, and the other one looking at hair and nail changes. Things when he cites that also.
Again, they relied upon it in ultimately writing their article.
Yes, they've cited it as a reference.
I want to talk about some particular findings at autopsy and see if we can help this jury understand potentially the degree in which it helped inform your opinion.
Okay.
As it relates to Benjamin, with the lack of mesenteric fat, what to you is that indicative of?
I mean, it's consistent with weight loss. I mean, it is one of those things that I have seen once in my career. So it's not something that, people see a lot, but certainly is described as an association with starvation.
Right. So the lack of mesenteric fat is what I'm going to categorize as positive indications and maybe negative indications. Positive meaning that it's consistent with it, negative meaning it's not consistent with it.
Okay. And I guess I would say also discuss the specificity of it. I mean, it's consistent with starvation. It's not specific for starvation.
Fair enough, right?
Yeah, okay.
I think we can agree, there's no test. There's no
Right.
way of just saying definitively this is starvation.
Yes,
We're looking at a constellation of symptoms.
that's correct.
So, lack of mesenteric fat, that would be consistent with the starvation.
Yes.
Do you have another explanation as to why Benji would have had zero or lack of any mesenteric fat?
No. I mean, it's certainly anything that's going to cause you weight loss, and which we know he has, but it doesn't mean that he's starved, but certainly could be from starvation. When I say starvation, non-lethal starvation, because I don't think he died of starvation.
It would be consistent with lethal.
But it would be consistent with, it's something that is seen in the setting of lethal starvation, yes.
The collapsed small and large intestines, maybe there's no food now. Would that be consistent with starvation?
It's a described finding in starvation.
And is there another explanation as to that?
Yeah, I mean, not eating, in a non-starving sort of setting. I mean, generally, the other thing we don't know from this is there wasn't a description in the autopsy report as to whether that assessment was made just looking at the intestines or if the intestines were opened to see if anything was in them. It's not normal in most cases for the intestines to be opened because it's an unpleasant experience. Sometimes you need to anyway, but generally they're not done, and I don't know if that was done in this case or not. So whether that's a subjective assessment of I'm looking at these, they look flat, I don't see anything in there, or whether they actually looked and saw whether anything was there, I don't know.
But the fact that they're flat, what does that mean?
It's just there's not a lot passing through them.
So, do you indicate a lack of food going into the body?
Yes.
And would that be consistent with starvation? Let's say non-lethal starvation.
It can be, yes.
What about fecal starvation?
It's a described finding in that histologically, when you look at the bowel under the microscope, the wall can be thickened. It's not just empty. There are other changes that go along with starvation that are not present.
So, do you have the autopsy report for you?
I do not.
Show this already been admitted into evidence. It states exhibit number 101. Says the large and small intestines are collapsed and contain minimal contents. Correct?
Correct.
Okay. How would she know if there's minimal contents?
You can certainly make that assessment by looking at it without opening it. So I don't know. She may have opened it. She just doesn't say one way or the other.
The thymus, the involuted,
Yes.
the thymus that atrophies,
Mhm.
is that consistent with starvation
Yes.
and lethal starvation?
Yes.
You heard Dr. Molina's testimony as it relates to macrocytic anemia.
Yes.
That can be consistent with vitamin deficiency.
It can be. It can be consistent with many, many things. Sometimes it's factitious. The vitamin deficiency anemias that are associated with enlarged red cells are typically what are referred to as megaloblastic anemias. And usually you see I think she talked about it, mean corpuscular volume, the size of the individual red cells is quite a lot larger than what Benji's were.
Okay. So again, my question to you is, macrocytic anemia can be associated with vitamin deficiency?
It can be, yes.
Okay. And vitamin deficiency can be consistent with starvation?
It can be, yes.
Including lethal starvation?
Yes.
As it relates to your review of this case, did you review any of the slides or have any slides prepared for your review?
I did not get to review the microscopic slides.
Would that have been important in reaching your conclusion today?
I think ultimately it wouldn't have changed it. She described everything as normal, so I might have identified pathology she didn't identify, but I did not.
So as it relates to diabetes,
Mm-hmm.
type 1 diabetes,
Yes.
would the slides of the pancreas help inform your decision?
Potentially.
And why would that be?
You can see dropout of what are called islet cells, the cells within the pancreas that make insulin. In type 1 diabetes, they may be reduced.
Okay. But Dr. Molina says that they're normal.
She said they were normal.
So there's no evidence of this islet dropout.
Not that she described them.
And that would be something you would want to know when ultimately reaching your decision as to whether diabetes was ultimately the cause of death.
I mean, it would help certainly if I see islet dropout, but its absence would not preclude that diagnosis because it's largely biochemical diagnosis.
So as it relates to defense exhibit number 53, the graph or chart that you prepared for Ms. Sawyer,
Yes.
is there evidence of stunting?
Yes, there is throughout his life. At a time when most children are not old enough to even show stunting. So
And you're basing that on the heights that are located within the medical records, right?
yes,
You would agree with me that those are pretty spurious.
many of them are, yes. And it's hard to know which ones are spurious, but for sure you can be reasonably sure if a child measures 99 centimeters one time and 89 the next time, he had to lose 4 inches of height during that whatever time period, because children generally will not lose height. They will stop growing, but they won't lose shoes height. So then the question is, was one too high and one was too low? I mean, it's hard to know exactly where those measurements, what the problem with the measurements are. And that's an important reason to look at the overall trends.
And fair to say, there's not too much conclusions you can roll, especially in older children, that you can reliably, that you can rely on ultimately reaching your opinion.
I mean, I think that would apply to any of the, whether you're looking at percentiles or whether you're looking at Waterlow classification, anything that's based on the measurements is only as good as those measurements.
And specifically on height, when we're talking about kids, you would agree with me, they're not always the most responsible.
If they don't take off their shoes, there's many reasons that might be. Kids wiggle, whatever.
You did a pediatric residency?
I did a pediatric internship.
Okay. Do you measure kids during that time?
I did not. Our nursing staff usually would do that.
Did you observe them that were measuring these children?
Yes, and I've observed my own children being measured. Yeah.
Are they always the most compliant?
No, for sure not.
Are you aware of the legal definition of serious bodily injury?
I am.
You are not?
I don't know the legal definition of it.
Don't you think that would be important as it relates to giving your opinion as to whether Benji suffered from serious bodily injury?
No, what I said was my understanding of that term, which is a lay understanding of that term, is how I'm answering that question.
Okay. So all of Ms. Sawyer's questions as it relates to serious bodily injury were based on your general understanding of what serious bodily injury is?
Yes.
What is your understanding of what serious bodily injury is?
Something that is going to cause impairment or debility in the person receiving it, or death potentially. Death would obviously be a serious bodily injury.
So in Texas, serious bodily injury is bodily injury that creates a significant risk of death or causes death, results in serious permanent disfigurement, or causes a prolonged loss or impairment of the function of a bodily organ or member.
Okay.
Do you understand that?
Yes.
So taking out the death, the fact that whether, for argument's sake, whether he died from starvation or not, prior to his death, up to leading up to his death, would you say that the loss of weight was bodily injury, a change in his body composition that created a significant risk of death?
No, not at the degree that it was.
Okay. And what was the percentage of weight that he lost during that period of time?
From his highest weight till his weight at autopsy was about 14%.
14%. Going to the Medea article on page 281. Patients with premorbid weight, a loss of 5% body weight results in detectable impairments of mental and physical function. After a loss of 10 to 15% body weight, nutritional intervention may be necessary.
Yes. And the next sentence says loss of more than 35% is life-threatening.
So, nutritional intervention may be necessary.
Yes, certainly if he's losing weight, somebody needs to address that.
Okay. And if it's not addressed, what's the ultimate result? Or what could result?
Well, it could continue. It may stabilize. You don't know, but it's something you would address. Failure to thrive is a common complaint in pediatric clinics because kids aren't growing or they're not, sometimes they're losing weight, sometimes they're just not gaining weight.
So, we're talking about, I know you make a distinction between malnutrition, undernutrition, and starvation. Is it that undernutrition is maybe a subset of malnutrition?
Yes. Mm-hmm.
Okay. So I want to talk about undernutrition. What are the potential long-term effects of undernutrition?
I guess that's primarily a clinical question. Obviously, death is ultimately potentially an outcome, but I believe there are other described things in the clinical literature, but I don't know all of those.
Okay. So, as it relates to the Texas definition of serious bodily injury, you're saying it's not serious bodily injury, but you don't know what the long-term effects of undernutrition are?
I don't know the specific clinical things besides death that can result from it. There are probably immunologic consequences, there are probably developmental consequences, but I specifically what those are, I don't know.
Okay. So, are you in a position then to even give an opinion as it relates to that?
You're talking in terms of serious body. If you're saying that weight loss, if those sequelae would be serious bodily injury, I wouldn't disagree that they are. I just don't have any indication that those things are happening in Benji at the time of his death.
Okay. So you don't know what they are, but you don't think they're happening with Benji. Am I understanding that correctly?
You could put it that way. I mean,
Okay. You don't know, but I know it's not that. Kind of what you're saying.
Okay, if you want to phrase it that way. So I don't know specifically what the developmental outcomes. I mean, clearly he's having some behavioral issues. Are those related to his nutrition? I don't know. There's family history that would suggest maybe otherwise. Other things that could be going on, but I don't know.
Okay. So, I wanted to talk about these potential differential diagnoses. I want to start with seizures. Am I understanding correctly that you said that a first seizure can be the cause of it?
Yes.
How would you diagnose that?
If you find evidence that the person had a seizure, and I mean, that's how you would diagnose it. You wouldn't, if in the absence of things like tongue biting, incontinence, other things, you wouldn't know that they had a seizure. But if they've got evidence of a generalized seizure and are dead without any other cause, that would likely be where you would conduct.
So you would, without knowing, not being able to test for a seizure afterwards, you would still say that that was a death caused by a seizure?
Yes.
So, without being able to even tell that they suffered from a seizure disorder, you would still opine that that was a death by seizure?
It could be. I might also call it undetermined. It would really depend on all the specifics of the case, but it certainly could be.
In your review of the literature, have you ever seen a case where somebody's first seizure was determined to be the cause of death?
I believe I testified that I have seen a case like that.
So you have made that opinion before?
Yes.
And so are you able to rule out other forms of death?
That's what the rest of the autopsy and investigation is about. There's no other organ pathology. There's no, we may find some abnormality in the brain that was not known previously. I mean, there's all kinds of reasons that we might make that conclusion where they didn't know.
So how in that case, how would you rule out suffocation?
Circumstantially, if it's an adult, you're not going to. I've certainly never made that diagnosis in a child.
Okay, so again, the suffocation, the arrhythmia, all of those things play into every single time you look at somebody's death, correct?
If you end up with a negative autopsy, those are all part of the differential, yes.
So in these cases where you said that you ruled the death to be a seizure, were you able to rule out suffocation?
Well, it's a case where I also have not a negative autopsy. I've got findings at autopsy suggestive of tongue trauma. I may find something in the brain, other things that are going to be consistent with that, even though they didn't have a diagnosis beforehand.
Okay. So let's say somebody has a seizure, there's been evidence of tongue biting. What if that person had their tongue in between their teeth and their mouth was being held shut and covered?
Mm-hmm.
Would you be able to rule out suffocation?
No.
Okay. So fair to say, not in every case you can rule out every single other possible.
No, for sure not. And that's why many times we end up with a cause of death that's undetermined or a manner that's undetermined.
But in those cases, you're looking at what does the evidence fit? Like, what is the likely result, right?
Yes.
As it relates to You also were talking about foaming in the mouth. What was that consistent with?
That's a finding that goes along with pulmonary edema, which is fluid in the lungs.
Okay. So, pulmonary edema, fluid in the lungs. Would that increase the weight of Benji's lungs at the time of autopsy?
I can.
What about the brain edema?
Cerebral edema would be expected to increase the brain rate. Brain is generally not atrophied in the setting of starvation. Your body does a lot to preserve your brain to make sure it stays normal. Everything else starts to shrink, but the brain does not.
So, in your review of the literature, brain atrophy is not a possible clinical finding in autopsy?
You may see it, but more often than not, you don't see it in the cases that are described.
Talking about the arrhythmia, talking about the abnormal gene. They would say that because you might be genetically predisposed does not mean that you have something, right?
Well, so there are a number of parts to that question. So you can be genetically predisposed to a lot of things, but if your genetic testing shows that you are abnormal in a certain way, then there are secondary questions to that. People can have abnormal genes and not die from them today. They might not die for 2 years. They might not die until adulthood. But if you find them and they have died and you don't have an alternative explanation, that is certainly a possibility if they have a pathogenic mutation of their genes.
So if you had somebody who had negative findings as it relates to their autopsy, you did this genetic testing afterwards, and they have a genetic finding for predisposition for arrhythmias, would then you conclude that they died from an arrhythmia?
Not necessarily, no. But it would certainly move me off of calling it something else, and would, it adds, I guess I would say it adds doubt as to what a specific cause is. That becomes very likely. What other things are likely? If they're all unlikely, especially, that leads you down the path of undetermined. I can't tell whether it's that or that.
But again, my question to you is that just because you have the gene, let's say Benji did, he had a genetic predisposition for arrhythmia, does not mean that he died from an arrhythmia.
Does not mean that he did. Doesn't mean he didn't, but it doesn't mean he did.
Look at your chart that you prepared, defendant's exhibit number 53. So based on Gomez at that time, he was moderately malnourished.
Yes, he was.
What are the implications of being moderately malnourished?
Are you talking about the clinical implications of that?
Let's start with clinically.
It's a problem that needs to be addressed, but the specifics of what they're going to need more nutrition, they're going to need to be assessed in an ongoing follow-up way, to be looked at on a regular basis to see that they're gaining weight, to do testing to identify possible causes for their lack of weight or loss of weight, depending on which it is. And you're going to go through those things, that testing, and then ultimately make informed treatment decisions about what they need to get out of that place.
As it relates to Benji's weight loss, did you find anything in the records, in your review of the records, that would account for this weight loss?
Not specifically, no.
Did you review the photographs in this case?
I reviewed a lot of photographs, yes.
Did you review body cam videos?
I did.
So did you review the photographs that had locks on cabinets in the kitchen that contained food?
Yes.
And you reviewed the pictures that had a lock on the refrigerator?
Yes.
filming Benji trying to get out of his room in the middle of the night.
Yes.
You reviewed the body worn camera video with Benji on 7/20 of 21, where he asks his dad multiple times for food.
Yes. While the police are there.
So in that, did you see the body worn camera video where Benji's speaking to Detective Hale?
Yes.
And in that video, you would agree with me that Benji's distracted by the food behind him.
He's kind of not focused on what he's being asked many times, yes.
And what is he focused on?
I don't know if it was food or not. I don't recall specifically. He may have been. I mean, there was food on the counter, I believe. I don't remember specifically.
In that, did you review the fact that Miranda, as well as the defendant, said that they put locks on the kitchen cabinets because Benji was getting out in the middle of the night to get food?
Yes, I believe that's the case.
Would you not consider that a form of restricting or restricting food?
I mean, potentially. I mean, my children, for example, were never up in the middle of the night trying to eat food, so I did never have to contend with that, and they were adequately fed during the day. So, I mean, it's hard to know exactly what that means. I mean, certainly if my children were up running around, I would be, more concerned about, having them, get their sleep, whatever it is. I mean, I don't, not having had a child in that circumstances, I don't know.
Right, because your kid wasn't starving. Fair to say?
Objection, Your Honor. I don't know.
Sustained.
So, fair to say that you don't have a child that's been dying from starvation?
And none of my children died of starvation now.
You reviewed the medical records from 7/21/21.
I did.
In that, the parents had indicated for your 9-month-old boy with a history of speech delay previous to his right here with chief complaints of bruising.
Yes.
If your child was having problems gaining weight, would you block it with food?
Can't answer it. I don't know. Would depend on all the circumstances surrounding, what's going on there.
So, if your kid wasn't gaining weight, you would potentially restrict the food that they were getting?
I might restrict what specific food they're getting, yes.
So, you would restrict them from getting any food?
But no, I mean, if they're having trouble weight, I would follow whatever medical advice I'm given and figure out how to get them what they need. These are not my professional opinions, these are my parental opinions.
Did you review the video of Benji in the car hitting himself?
Yes, I did.
In your review of cases and ultimately determining the cause of death, you reviewed blunt force injuries before?
Yes, many times.
And in time try to determine the mechanism of injury?
Yes.
looking at Safety Exhibit number 223, which indicates was created on August 19th, 2021. I'm going to play the only video on this video. I'm not going to play for the whole video, but did you review this entire video?
I did.
Would you agree with me that he essentially hits himself at about the same level of force throughout this video?
It seems to be.
From you? In reviewing that video, you also reviewed the scratching photos from 7/21 and 21, correct?
720, I believe.
7/20.
Yes.
Put it on. Put it down and get me one. Looking at defense exhibit number 31, does that level of force seem consistent with the injuries that Benji sustained in defense exhibit 31?
No, I don't think so.
Your Honor, I'm gonna object in the stating in the case that the video versus this, there's no connection in our evidence so far that those alleged injuries are or even cause or anything. They have, it conflicts, like, he's interjecting evidence that isn't before the jury.
I'll let you direct. Are you asking, or is your objection facts not enough?
Yes.
It's in the body worn camera. It's been alluded to that he's causing these injuries to himself.
But you guys have heard of this.
would that have caused these types of injuries?
I think it's,
Okay. So, showing he was admitted as state exhibit number 94 to review this photo.
yes.
You can see in between his ribs in that photo, correct? Because in fact, you can count some of his ribs, right? I can see, would you agree that you can see a rib here?
Yes, you can see those.
And then it's sunken down a little bit, right? And then you can see the next rib.
Yes.
Okay. This type of visual, this being able to see between the ribs, is that also illustrated in the literature that you?
There certainly is that sort of picture. Although it's much more dramatic.
I'm not asking about the pictures, but as it describes some findings that are typical within starvation behavior. Is this the, what I'm saying, intercostal,
Yes,
where it's between the ribs, it's sunken?
it becomes noticeable, yes.
Right. So that's described in the literature as it relates to starvation
That's correct.
and even lethal starvation.
Yes.
So, when we're looking at this, or looking at starvation, is it fair to think about this as like concentric circles? Like where certain findings might exclude certain things, right? So we're narrowing down ultimately to what is the cause of it. Fair to say?
Yes.
Right, so some findings might eliminate something, some findings might just be consistent.
Correct.
And in this, there are multiple findings, you would agree with me, that are consistent with starvation.
That are described in the starvation literature, yes.
And many of those are also indicative, or I don't say indicative. Many of these items or pieces of evidence are also cited within the literature as it relates to lethal starvation.
Yes, that we've seen.
Right. And as it relates to the Waterlow, Gomez, all these anthropometric clinical or anthropometric tests, or however you want to describe it, none of them have a cutoff at which point starvation can be ruled in, meaning there's not like a cutoff of where lethal starvation starts or ends.
There's not a diagnostic number.
All right, listen, I'll pass it.
Yes, just briefly. So I'm showing you what going back to your chart in regards to the three columns that you had identified.
Yes.
You, from your understanding in the literature, you found that the last column, if I'm not mistaken, the Waterlow weight column was the most relevant. Is that correct?
Yes.
Now, in regards to Gomez, why did you find that Gomez was less relevant?
Because it does not factor in their height relative to their size. It's only a comparison of their weight, their actual weight, to what the average weight for a child age is.
And Benji's always had a small stature.
He's
correct?
always been small.
And so the data that you did provide that exists of the 18 cases that have been compiled is associated with the Waterlow chart, correct?
It is, yes.
Okay, not the Gomez chart.
Correct.
And this is an accurate representation of the data compilation that existed in the article that Mr. Villarreal was questioning you about, correct?
Yes, that's correct.
You didn't change it at all?
No.
Okay. Now, you saw multiple videos of Benji. You've seen every video that the jury sees, correct?
I believe so, yes.
And in those, would you agree with me that Benji had no problem getting out of his room?
Did not seem to, no.
And he had no problem getting into the cabinets?
No, it seemed he even was able to get into closed cabinets, the fridge at least, I don't know about the other cabinets, but he was getting into things, yes.
In the literature that you did review, including Dr. Lukaford, were kids that were determined to have died of starvation generally either bound or somehow locked in a room or somehow physically prevented from getting food?
Yes, that is described in that article. Most of the children that die of starvation are infants. If you look at the overall numbers, most are infants who really can't do anything to provide for their own nutrition. And children up to the age of 3 really can't do a whole lot to get their own food if they need it or aren't getting it. Once they get beyond that age, then they have more ability to forage and rummage, like Benji showed he could do.
And so, in Benji's case, after reviewing everything, did you see any indication that Benji was, any evidence that he was locked into a room?
I did not see that, no.
And when he is in a room, he's with his other siblings, correct?
Some of the videos, his siblings are in there, some of them he's in there by himself.
And all of the other siblings also indicate that they don't have any issue with weight.
I'm gonna object to this one.
Okay, all right. So the point is, was he removed from being part of the family in any of the videos that you saw?
Judge, at this point, I'm objecting to
It does not appear that he's isolated.
And
Again, I mean, he's in his room by himself sometimes, and so whether that was an isolation thing, I don't know. But certainly he's in his room sleeping with his siblings. One of the videos where he's up in the night, you can hear a sibling in the background. So he's others are around.
And he is being taken out in public in a lot of these photos.
Yes.
And I need to ask you about the length of time that, how long does it take, does the literature say it takes from the time someone eats something to the time it passes through them?
There's a wide variety of what that can be, and there's a number of studies that have been done over the years using things that they can see on X-ray if they have a kid eat, and they track how long it takes to go through. But the ranges that are published, range anywhere from 10 hours to as many as 70 plus hours.
And in regards to that, have you also reviewed Dr. Luker's testimony?
Yes,
And did he find that it was a 6 to 8 hour?
that's what he stated, yes.
Okay. And so if someone eats, I'm going to give you a hypothetical. If someone is provided a tortilla, or excuse me, a meal at the night before, and they go to sleep, and they wake up the next day, is it possible that they could have a bowel movement from what they ate the night before?
I mean, I think it would be unusual, but certainly it's possible. It's within the range of described times.
So the 10 hours to 12 hours?
Yes.
Okay. And so here we have a bowel movement from Benji.
Yes, we do. might see it in the digestive tract, you might see it in their stomach. It would depend on the time interval. Generally, the stomach's going to empty within a couple of hours, but it can take longer depending on what it is, how much water is consumed with it. I mean, a lot of variables there, so I don't think you can be very precise about the time. It might still be in the stomach. It would almost assuredly still be expected to be present in the intestinal tract.
Okay, and, so what about when you are suctioning something out, would a tortilla be able to be suctioned out?
I would think mostly no, if it's mostly just the tortilla that's there, but if it's diluted with a bunch of water, if it's softened up, I mean, you might get, I mean, certainly I've seen in my clinical experience, chunks of things get sucked up through nasogastric tubes.
And acids?
I just have a couple questions. What does atrophic musculature mean?
I'm sorry, can you repeat that?
Atrophic, I might be mispronouncing it.
No,
Atrophic maybe?
atrophic.
Atrophic musculature, what is
Oh,
it?
musculature. Atrophic musculature would just be less than normal musculature. Atrophy is a condition where things start to waste away or shrivel away.
Does that mean that the muscle is wasting away?
Yes.
Benji, you testified that Benji did not appear isolated, correct?
I mean, to the extent, like I said, he's isolated in his room in some of the videos, but he's with his siblings in photos, he's with his siblings in some of the other videos. So, you know, socially, I don't know overall. I just know what's in the photos and videos.
So you agree that some of those videos, there's no other kid in that room when Benji's crying?
That's correct.
And there's no cases in those videos where Benji's crying for things like food, water, milk?
I don't recall the specifics of those, but he's definitely by himself sometimes.
Right, and in those, at least one of those videos, he's crying for something.
Yeah, he's crying for sure.
You reviewed the photographs?
I reviewed a lot of photographs.
I should be clear, the photographs from August 17th of 2021,
From,
the apartment.
oh, the apartment, yes.
And you saw 3 beds in the bedroom.
Yes.
Did you know which one was the empty bed?
It had to be identified to me, I didn't otherwise know.
Did you notice a difference in the beds?
Yes.
And what was the difference?
The difference was that one of them was essentially just a mattress.
Was it covered with anything?
I don't recall. May have had a cover on it, I don't know.
That bed was definitely different than the other 2.
It was, yes.
Benji could get into the closed cabinets. Do you know Benji could get into the closed cabinets?
Like when they were locked, could he unopen them? I don't know. I know he opened the fridge in one of the videos, but as far as the cabinets, I don't remember.
Okay. So did you view any videos of Benji opening the cabinets when they were locked?
Probably. I don't remember specifically.
Okay. I was surprised to know that. I don't have any videos of that.
No, I mean, I just don't remember.
Did you review videos of Benji like moving items to get out of the room?
I saw him like setting pillows by the door, trying to stand on them to get over the gate. I saw him moving a table, but it wasn't clear that's exactly why he was moving it, or a dresser or something. But yes, he was moving items in the room.
Okay. And in one of them, he moved like a pillow.
Yes,
Another one, did you see him with like a laundry hamper?
probably. I don't remember that specific item.
And in those, he's trying. Is it clear to you that he's trying to get out of the room?
Yes, he's trying to get over the gate.
I'll have this.
Yes, Your Honor.
Dr. Thank you very much for your time tonight. If you have anything, give that to the clinician. Can I see the charts, please?
Nathaniel John Gebhardt.
And now, what is your education and experience? What do you do for a living?
I am a pediatric intensive care doctor at University Hospital.
Okay,
I'm a
and in order to become a pediatric critical care doctor, what do you have to do? What's your education?
I went to the University of Texas at Austin. I majored in, or I have a degree from the business honors program. I then went to medical school in Dallas at the University of Texas Southwestern Medical School. From there, I did a residency at Duke University in pediatrics. From there, I did a couple of years of fellowship in critical care at Texas Children's before having a baby, resigning a position for a year, working as a hospitalist in Midland, and then came back and finished up here in San Antonio for my last year of fellowship, and then stuck around on faculty.
Okay, and how many years have you been a critical care pediatrician?
As an attending physician, I've been practicing since 2016. So
And are you board certified?
I am.
And what are you board certified in?
I'm board certified in general pediatrics in 2012, and then in 2016 I was board certified in pediatric critical care.
I'm sorry, 20 what year?
2016
In critical.
in pediatric critical care.
And so, can you describe what pediatric critical care means?
Pediatric critical care is a subspecialty in pediatrics where we take care of anybody who comes into the hospital who is critically ill. So that can be people that need blood pressure support, to people that need really frequent interventions on their eyes, people that need ventilators, people that have failed ventilators and need a heart lung bypass machine. Those are the kids that I take care of.
And so, is it fair to say you see kids sometimes on the worst day of their lives?
I would say that I meet kids on the worst day of their lives a lot of the time.
And in doing so, I mean, have you ever had children pass away through your care?
Absolutely.
And now, when we talk about what's at issue in this case, have you had a chance to review this case?
I have.
And in reviewing it, have you reviewed the medical records
I have.
and some of the videos and photos in this case?
Yes, ma'am.
Okay. And so, at this time, Your Honor, I'd like to use the same demonstrative that we went over, but this one will be Defendant's Exhibit 56 to guide the questioning. May I publish?
Now, just to make sure, I have the last exhibit numbers.
You haven't, I have them.
Okay, so defense statistics, did you do that?
All right, so, you and I have discussed showing you what, as a demonstrative, is Defendant's Exhibit 56. And, Brandon is standing accused of having a legal or statutory duty to act, whether he was a parent or had care, custody, control of the child. But he had a legal duty or statutory duty to act, where, intentionally or knowingly caused serious bodily injury by failing to do one of those three things: adequate nutrition, adequate hydration, and proper medical care. And would you agree with me that this is what we're focused on in regards to your testimony?
Yes, ma'am.
Okay. Now, in going over that, let's first take up dehydration. There's been testimony that Dr. Molina did not find dehydration in this case. Would you agree with that?
I would say that there is evidence of dehydration, that would be non-fatal dehydration.
Okay. And so, non-lethal dehydration.
Non-lethal, yes.
And let's talk about the definition of serious bodily injury. serious bodily injury in Texas has a specific definition. It's would significantly, is significant risk of death. It's cause death, or it could permanent disfigurement, or the
Organ damage.
yes, but let me make sure I word it correctly. Sorry. The last one is prolonged loss or function of a bodily member. I mean, give or take a word or two, but in general, that's what it stands for. And so in regards to reviewing on dehydration, did you believe that the dehydration in Benji's case would have caused him serious bodily injury?
No.
Now, in critical care, after reviewing the evidence, did you find anything that would indicate that he was not intentionally dehydrated?
When I was reviewing the case, it didn't seem like he was intentionally dehydrated. The child, from most of the photos that I saw, tended to have wet diapers on, which indicates that he had fluid inside of him.
And in regards to the loss of fluid that he's experienced that day, did you get to see a photo of the mattress with yellow substance on it?
I did see a picture of the yellow substance on the chest.
And that photo came from the day he passed, correct?
Yes.
And then there was also photos of the front seat of a car that looked like there was liquid or something where he was sitting.
Yes.
And did you see the diaper that he was wearing at the time he gets to the hospital?
I saw the one on the autopsy. Yes.
And was it full?
It seemed full.
Okay. And so, in regards to your experience as a critical care pediatrician, if a child comes in and they've lost water, is there a way for fluids? Is there a way for you to determine how much they've lost?
Typically, in children, there's a couple of different types of dehydration. This one seemed to be a hypernatremic dehydration, hypernatremia being high sodium levels. And so on the vitreous exam, the sodium, I believe, is around 160. And so it seemed like you can quantify it based on a free water deficit, to get kind of technical. So you take the total body water of a patient, which is about 60% of their weight, and you multiply that times the sodium that you have divided by a normal sodium minus 1. And so for him, 160 over 140 gets you about 14%. And when you subtract out the 1, and then you multiply that by 0.6, and his body weight of 12.7, it gets you to about 1.08 liters.
Okay, so in your estimation, and you use this
In my clinical practice, I see kids that are dehydrated from diarrhea, vomiting, pretty frequently.
and so this calculation, by your estimate, are you trained to use that estimate?
Yes.
You are telling us that he would have lost about 1.08 liters of water?
About that, yes.
Okay, based off of the sodium. How much this bottle of water?
This is 1 liter of water, so this weighs about 2.2 pounds.
Okay, so this is 2.2 pounds, and would that also be the same? 2.2 pounds is the same as 1 kilogram?
Yes.
Okay. So that 1 liter of water 1 liter, 1 kilogram, and 2.2 pounds. Those are all equivalent.
Those are cool.
And so, based off of the fact that, did you also, was there anything, any indication, you said that diarrhea or vomiting. Did you have any indication of diarrhea or vomiting in this case?
So when I was reading the medical record of the day he presented on his final day, there was mention of from his mother that he had been potentially vomiting the night before.
Okay, so that might, along with the urine that seems to be coming out of the child, that's, that account for that 1.08 liters of.
Yeah, to lose that amount of water, yes, you can either vomit it up, have diarrhea, pee it out.
And that's not, that in of itself is not someone's fault, correct? I mean, if they're vomiting or peeing, it's nothing that a parent would know. I mean, they didn't cause the child's vomit.
Judge, I'm gonna check the cost.
I mean, is vomiting or urination, is that a child abuse?
It is not child abuse unless you have given a child some sort of poison that has caused them to vomit, or made them sustain some sort of brain injury that caused them to vomit. I would not consider that child abuse. Kids, especially 4-year-olds, tend to get sick.
And so in this case, we had no evidence that he sustained head trauma, correct?
From the autopsy, he did not have any brain findings of traumatic injury.
And there was, the toxicology for drugs was negative, correct?
Yes.
So those don't exist in this case as part of the fact pattern, correct?
From what I gathered, that was not part of the case.
All right, so in regards to dehydration, as we're looking up there, do you believe that there was a failure to provide adequate hydration in this case?
If he had access to free water, then I would say that he did not, that's not child abuse. If he was able to get to have water, that's not child abuse.
Well, and based off of what you're observing, is there any other indications? Not just whether he had access to it, but based off what you're viewing from the body itself, do you believe that there was a dehydration to the level that someone was not providing it?
It didn't seem like that to me.
And then in regards to seeking medical care, did you find, I mean, in your opinion, was there evidence to show that proper medical care was sought?
So as a pediatrician, you see all types of parents, but usually if you're asked by someone to show up at an appointment, then you show up and you're doing your due diligence to follow up on whatever they ask you to go do. If you show up to your appointments, then that's a sign that you're seeking the appropriate medical care.
And in this case, did they show up to their appointments?
It seems like they did. There were several doctor's appointments prior to his, in the last couple of months of his life.
And in regards to the directives he was given specifically on July 20th or 21st of 2021 from CHOSA, did he follow them? Were those followed?
I believe so. He was told to follow up with his pediatrician. He was told to follow up with his pediatrician, and it seems like they did.
Now, so in regards to whether or not there has been a failure to provide proper medical care, do you believe that there was a failure to provide proper medical care here?
I think that if
Let me rephrase that. It actually should be failure to seek proper medical care, not provide. So,
I think that they showed up to their appointments as they were asked to. And when people saw him, they weren't like, man, this kid is incredibly gaunt. They weren't saying, hey, we need to hospitalize this kiddo. They were saying, hey, we need to compete with all of this.
So in regards to the adequate nutrition, which the state, we're really talking about starvation. Have you in your practice have any experience in regards to treating patients that have been diagnosed with starvation?
Yes, I have taken care of several children with failure to thrive. Some of them with severe failure to thrive. I took care of a kiddo that was an immigrant from Ukraine who had been in an orphanage where he was systematically starved for months, given drugs not to make noise, just eerily quiet when the parents walked in. He was severely underweight. I've taken care of kids who have been sold into kind of prostitution and have been.
It's probably not going to touch it all.
Your Honor,
The specifics of this case.
The specifics of those cases are.
that's the famous to those.
But yes, I've taken care of multiple children who have had severe failure to thrive and what would be considered kind of a starved state.
And in those instances, would that have been serious bodily injury by starvation?
Yes.
Have you, in your opportunities to review Benji's case, do you believe that Benji had serious bodily injury by starvation?
I did not see evidence that he was severely malnourished. He was a skinny kid, for sure. But he didn't seem to be so severely underweight that it required inpatient hospitalization or even get to the level of critical care.
Okay, so if Benji had walked into your hospital room or your office, did you see pictures of him on the day of his passing?
I did.
And so I'm showing you what's been marked as Defendant's Exhibit 22. How does Benji differ from the kids you've seen with serious bodily injury by starvation?
So when I see kids with severe starvation, they usually have thinning hair. They'll have, if it's an acute weight loss, they tend to have a lot of loose skin around their arms, just from that really acute weight loss, which I didn't really see a ton of loose skin. You'll see it like just completely wrinkled down, like someone who's lost a lot of weight. His bubble fat, like his face looks a little bit skinnier, but I see skinny kids periodically. It is San Antonio, so you do see a lot more than you see here. But he doesn't look, he's still got some fullness to him. He doesn't have sunken eyes. Those are the things that I would say.
And I want to be clear what the word acute means. What does it mean?
Acute is in the last, if you've lost a significant amount of weight in the last couple of months, I don't know the exact definition off the top of my head right now for acute, but it's less than, it's definitely going to be in the last month.
Okay. And then versus chronic, which is what?
I'm going to say over like 6 months, where you're really having a lot of pathologic changes.
Okay. And so, let me ask you as well, with kids, is there a difference in the way they present from the age of like, let's say 3, and as they start to go from 3 to 5? Do they have facial changes of any kind that are?
So kids, especially on the low end of that BMI chart, when they'll hit an 8 year, so they start, babies when they're really, really little, they're chubby little things, and then they start crawling, start moving. And when they do that, they go from little chunks to a little bit stretched out. When they hit this 3 to 5 year old range, especially on that lowest end of the curve, they start hitting an 8 year, and that 8 year kind of spans from like about 5 years old over to about 7 years old.
Okay, so
stretch out. So this is when they're basically going to start changing and start looking more like little boys instead of toddlers.
So facial changes in which a face might be getting skinnier, would that always be to a loss of weight?
You can gain weight as long as you're gaining more height. You can have those changes.
Okay, so, in regards to Benji, as far as lips and stuff, do they appear cracked or in any way dehydrated?
If you're dehydrated. No.
Now, the state has an exhibit that is, you look at the autopsy photos in this case. I'm showing you what's been marked as state's exhibit 36. And, this is a photo of Benji.
Yes.
And, in regards to his ribs, can you see his ribs?
Yeah.
Okay. Now, what about his legs? Do you notice anything about his legs that's significant?
He's got decently normal quadricep muscles and calf muscles at that point.
And so by that, you're looking at this right here.
I'm looking at his calf, yes. And then if you go up, you can see that he's got muscle tone across the top of that.
Okay. And then, so you are not just a medical doctor, do you have children?
I do.
How many?
I have 3 kids.
Okay. And so you've seen boys grow up from, well, how old are your kids now?
I have a 10-year-old, an 8-year-old, and a 5-year-old, about 2 years.
Okay, and in regards to what we normally see in healthy, active children, are you able to identify that?
Yes.
As far as what their rib cages look and their bodies look like?
Yes.
Okay, and I'm showing you what's been marked as Defendant's Exhibit 54. Do you recognize this photo?
Yes, I do. That is a picture of my kids and my nephew from 2 weekends ago.
Okay, and so would you agree with me that your kids and your nephew are not starved?
I would agree with that. In that photo, they had already eaten individually both $22 worth of Chick-fil-A sandwiches.
And so, in regards to this, does this help you show the jury what your ultimate opinion in regards to the rib cage is in regards to Benji?
I can see it. It is not a pathognomonic finding for starvation necessarily.
And would it help if they were able to see what?
Sure.
what you-
So if you look at my nephew there, he went to the pediatrician.
Oh, hold on one
Oh,
second.
sorry.
Your Honor, at this time,